Okay, everyone, and welcome back. This is episode 3, the topic of skincare as a whole. We talk a lot about skin. So I think that that's a large deficit for some people, including myself, is that not all of us get that opportunity to do a dermatology rotation or do a plastics rotation. And most of, at least what I can speak to, is RN and NP school. We don't deep dive into skin and really treating skin. What I will also say about that is when we look at some of the clinical practice guidelines and we look at some of the things that they tell us to look into, it's nice for me to talk to Kyra about things because she has that experience. She's put people on those specific protocols, and then I can ask her, like, in your experience, what do you think about this? Welcome, everyone, to Kyra's Skin School, like I like to call it. I think the first thing we could address would be that people don't need 20-step routines and they don't need to make it too complex. I don't want to speak for your experience, but in my experience personally and with patients, people end up messing their skin up because they're doing too much.
Yes. It's like all the songs like, girl, you doing too much. Like they are doing too much. And I've done too much. Like I struggle with acne and rosacea for years and nobody could kind of figure out the best way to treat it. And actually that's what got me into skincare and being obsessed with it. I mean, I spent countless, dollars at like every place that you think that you want to get skincare, from Sephora to counters at the mall to Target to all those things. I mean, like from the bottom line of Neutrogena and like, the Clean and Clear scrub and the St. Ives apricot scrubs back in the day, up to, the like $500 La Mer, infused like C serum and all of those things. And skincare is one of those really tricky things that your skin will get mad if it has, too much, but it also gets mad if you don't have enough. And there are a lot of like really hard and fast rules that people will present to you with skincare rules and like regulations or whatever, their skincare norms, right? Where it's like, oh, you have to have, a moisturizer, you have to have like a cleanser, like an acidic cleanser, all these random, based on nothing things that they have used during practice. And that's their hard and fast truth. Like our dermatologists love them some Cetaphil and some CeraVe. There are some patients that love them too, and absolutely no shade to either of those products, right? Like there are some people that their skin really genuinely does love that and their barrier thrives with it and they can do very well with it. And then there are other people that are really struggling with their skin, and your skin is in charge, right? I can tell you, my best theory on what's going to work best for your skin. But the two crummy things about skin are, number one, that your skin makes all the decisions. And number two, you have to do it slowly. I think the hardest thing with skincare, overhauls, even if your skin hates every single product that you're currently using and your barrier is totally fried and your skin is super angry, if you take every person off of every single product that they're using and start a whole new regimen, unless they're willing to have like a 2 to 3 month horrific adjustment period, they're going to be just as mad off of it. The best way to deal with skincare is titration, pulling people off of, some products, putting them on to others, and really slowly doing this for like weeks at a time. And so it kind of sucks because it's not like a cool, sexy thing. And then in 2 weeks, your skin's gonna be perfect. No, that barrier is fried and we need 3 months to repair it. And that 3-month number comes from 2 skin cycles. Every 6-week period, your skin is shedding that surface layer, to kind of just super simplify it, that surface layer of skin. And so we need 2 skin cycles, 2 full skin cycles to see what changes, we've been able to make with skincare. That's after we titrate though, right? So this is like months to a year long process, and some people to find that perfect formula. Now, is it going to look a lot better, after like, 6 weeks to 3 months? Sure. Are we going to be perfect and still fine tuning it? We're not going to be perfect, right? I have patients where they had horrific cystic acne. We cleared everything up and they still every once in a while get one pimple during their period, or around their cycle. And they're like, oh my God, can you believe this? And I have to pull up their picture. And I'm like, girl, listen, we're going to get the occasional blemish. We're going to get the occasional little flare. That's okay. But we went from like, 100 to 1. Those are the things where we adjust so quickly, and myself as well. Like when I'm the patient, right? Like when things are looking good, we adjust so quickly to the positive changes that we forget, we acclimate to them. And we're like, oh my gosh, and when we don't look back and say, hey, like, here's the photographic evidence of where we started with your skin versus now. If they still get like a little flushed, during certain times of the year, or like a little rosacea flare here and there, we've come so far. And so that's the unsexy part about skincare, right? Is like low and slow, honestly, is the way to do it. And there are other providers who have different mentalities. There's some, they're like the ZO protocol, right? Sometimes I'll do an overhaul with people where I'm like, nope, let's go ham. We're going to go full ZO. We're going to do hydroquinone, a ton of retinol. We're going to strip that whole surface because the barrier is already fried anyway, right? So if we're doing a hard reset, we can do it that way. But in terms of finding like our forever skincare plans or like our general guideline, our map of skincare, slow and slow is going to save you so much time and trouble in the long run.
Our society, we want things so quickly. So I think it's the same thing. Like we want immediate changes with our skin, and myself included. A couple of years ago when Kyra and I first met, I was having this horrific time with my skin. And I think that everyone's like instinct is to do more.
Which ironically does work in some cases. So that's kind of the hard thing where it's like that balance, but it's product and person specific. Like you can fry off with retinol a lot better than you can fry off with acids. If you're talking about certain types of like purging and other things like that, like retinol is actually your friend, ironically, even though it causes more of that known irritation than, just hitting the skin with a ton of acids that totally compromise the barrier.
Before Kyra and I had met, only know what they give you or what information you're getting, and majority of the medical spas are going to have quote unquote medical grade skincare. And the training that you're going to get on that is going to be from the representatives that come in, and they're going to give you samples of their newest product or random products or like their favorite products. And I think we get into these little traps. If you have this skin type, you use this. If you have this skin type, you use this. And then as new products come out, right, the way that these companies are marketing these products, they're great at it, right? They're going to tell you that they're anti-aging, that they're fast, and they're Botox in a bottle and whatever you want to call it. It's very hard to actually build like a true customized protocol. I can honestly say like I didn't really know what I was like doing. Still a complete learning process. In terms of customizing a true routine, like I'm definitely far better after Kyra came into my life. And so is my skin, because what I'll say is that I had an overgrowth of yeast growing on my forehead.
Which became really popular after that, which is really funny. Like then everybody thought that they had fungal acne. And I was like, hang on, not everybody. But you really did. You had the fur, the Malaysia fur. Mm-hmm. It's a cute name for not a cute thing.
She was strong. And let me tell you, in terms of patience, I was like, okay, great. Like it's clearing up. Thought I could stop the dandruff shampoo.
I remember what I said. I said, I said at least 6 months.
And it was honestly, I probably used it for a year. What I'm telling you is in terms of patience and in terms of thinking that this is just going to turn over, like it has to be turned over right now. Like, what are we doing, skin? No.
I think the better way to look at it is acne and rosacea are things that go into remission. When we are acne and rosacea prone, when we have rosacea and acne, however you want to describe it, these are things that go into remission. These are kind of forever underlying tendencies that our skin has. Same with melasma. A lot of skin conditions are things that can kind of flare up. And that's the hard part too, because you have people who will literally say like, oh, acne is not influenced by food. It's not influenced by anything else. They're like, you can take a piece of pizza and unless you're smearing it on your face, what you eat doesn't control your acne. But to a degree, a lot of these things, like our skin is our biggest organ, right? And anything that causes inflammation in any person can cause those skin, can trigger the skin to cause, those less than desirable outcomes like acne and rosacea. So I think we've oversimplified it to a degree, where people are like, oh, like what you eat doesn't affect it. No, not necessarily pizza, right? Somebody might get flared from like the rosacea. You have those patients where their hallmark, right? It's like the heat, coffee, caffeine, hot, spicy foods. Other people can absolutely have severe rosacea, eat spicy foods, drink coffee, do all those things, and none of it flares, but they come into contact with blueberries, or something super random, or if they have a lot of sugar, a lot of people have a lot of different flares that we just haven't necessarily identified, and they're very individualized. And then you have, generalizations that can apply to some people, but not everyone. And I think we're really over relying on a lot of the generalizations. So I just explain it to patients like, hey, inflammation of any kind is going to cause these underlying, things that we have or we're predisposed to kind of flare up again. And so we can kind of control that in a lot of different ways. But I just explain it that way so that we're not, oversimplifying things that are making it, easier for providers to just hyper generalize for patients, but that we're also not blowing people off, because a lot of times people have struggled with their skin for a really long time and a lot of their feelings get invalidated based off of these like generalizations and saying, oh, well, what you eat, doesn't affect anything. And they're like, well, you know what I've noticed every time I consume blank, right? My acne will flare up. And people are like, nope, that's impossible. And I'm like, well, you've lived in your body a lot longer than I have. Who am I to tell you that that's not true? And if it's something that you realize, right, we can work around it or work with it. I'm not saying cutting everything out, because there are some people that do that. I'm like, okay, we don't need to not eat anything. They'll get those allergy tests, and then they'll say they're allergic to every single thing. And I'm like, okay, like you can't just survive on lettuce. Like we can't do that. That's the hard thing. I think the generalizations, like again, skin is our biggest organ. There's so many different things that are going into the way that our skin is reacting. So to say that, we're addressing it with products alone, absolutely oversimplification. But also you have those patients that have been put on Doxy for 10 years on and off to deal with their rosacea. And they're like, I've been on metronidazole and Doxy for 10 years. And my dermatologist says that there's nothing else that we can do. And I'm at a loss, right? So I inherit a lot of those patients where they've been on prescription medications, they've been doing the same thing. And what the definition of insanity is doing the same thing over and over and over and expecting different results. That's how I feel for them. And so I always try and break it down and say, okay, like what have we tried before? Where do we start? Have you had any improvement? And there are some people that genuinely have been put on medications that I don't understand what provider picks Dapsone as a first line for rosacea. But I've seen it. And I'm like, hey, they're like, yeah, no, I can't go out in the sun anymore because I get these, blisters all over my face. And so I haven't been able to do anything outside in however many years. I'm like, well, did it, is your rosacea cleared up? Was it really severe? No, that really hasn't gotten better either. And you're like, okay, some of the stories that you hear, and who's to say, right? You get a truncated history, you're dealing with someone who maybe you didn't get all the facts. So I never want to call out providers that have seen it in the past. But there are some things where it's like, you have the same mentality, and I get it. Like they have 10 minutes to see patients. I have an hour I can spend with them or more, as much time as my heart desires. And so that's a very different experience that they can have. So I've definitely taken patients off a lot of different medications. And I typically always love to get the blessing from their other provider and say, hey, do you mind if I manage this? Or like, let's titrate you off of that. Others where I'm like, you've been doing the same thing for 10 years and they won't get in to see them to take them off of the metronidazole. And I'm like, I'm happy to put you on an azelaic. And sometimes it's something really stupid. Like I'll take them off of a metronidazole and a clindamycin, and I'll put them on like an azelaic and or a retinol or like a couple different skincare products. And like within like 3 months, their skin is perfect. And it's not typically that easy, but there are very simple things where my first line for rosacea is very different than like a standard first line for rosacea, right? And a lot of the sensitive, products for sensitive skin are the most irritating to those patients. And that's the one thing that I actually conceptually and scientifically don't understand, like how it is that way. But it's like the products for sensitive skin, in quotes, seem to flare them up the most, which is really funny. But basically, I guess the premise of skincare, right, and what I try and do with skincare is, number one, take into account what's the patient's biggest concerning factor, because they may have acne, they may have rosacea, they may have melasma, may have just sun damage or pigment, they may be starting to age. What is most important to them? So figure out what their most impactful thing is, because if they, have melasma and acne and rosacea, but really only care about their sunspots or their melasma, start with that, which inherently you're going to be addressing everything at the same time, but focus on one. Now, the complication with that comes in terms of the acne rosacea. And I will tell you that there is a separate skin subtype, and you know this, how I am. There is a separate skin subtype of that combo acne rosacea skin. They don't respond very well to standard acne protocols, and rosacea, like typical rosacea protocols, fuel their acne. The typical acne protocols fuel the rosacea. The rosacea then compromises the skin barrier, and then the skin barrier makes the acne worse. And it's like just dominoes. So that is its own separate skin subtype for me. And I handle that very differently than I handle patients that have just, I would say, a truly slightly more standardized acne, or a more cystic acne, versus the patients who are truly more of a standardized rosacea, right? And nobody's standard. Everybody's an individual when it comes to that. But that acne rosacea subtype, I think, is the Achilles heel of modern dermatology. And the oversimplification works the least for that subtype and that group. And that's who I see the most of, because they're the most frustrated, because they've gone through all of the channels. They've done all of the stuff that they're supposed to do. They're following all the protocols, and they're super disheartened and struggling. And it breaks my little heart because that was me. So for them, you have to really focus on skin barrier more than anything else. Like, you could have a patient that has a ton of sun damage and really mild rosacea, and you could hit that pigment hard and you can get, really beautiful results with it. And with a lot of that, it's quite simple. But those acne rosacea patient combos, like, you need to sit them down and have a conversation, say, this is a journey. And it sounds really kitschy. It is a journey that we have to go on together. We're going to find the right things that work for you. We first have to heal the skin barrier, which unfortunately is not like directly targeting the acne. So when you have that patient that's really used to going ham with all of, the heavy acids and other things because they just want to strip off that acne. So they're trying to just like peel off their face essentially. You can't always do that and go right in and treat the acne. You got to heal the barrier first, then you can come back and hit the acne. Will you get some inadvertent improvement? Yes. But when I say heal and fix and, our endpoint is resolution, right? So like, it can be 50% better at that 3-month mark or 6-month mark or wherever we're at. But I want you at the end to have essentially poreless, flawless, like minimally red skin with no pigment. That's my definition, like the kind of glass-like skin. Now, are we going to have a little bit of red on the cheeks? Yes. I mean, some patients actually, it's like literally glass. But there are certain things where it's like, we have to be realistic about expectations. But that's my goal for everyone is poreless, beautiful glass-like skin. And if we have, old acne scarring and other things like that, those things are not going to be addressed with skincare. Capillaries, certain levels of rosacea, other stuff. No matter how amazing you are, the best providers in the world who create their own skin lines and things like that cannot get 100% without, peels and lasers and other modalities integrated in. And I think a lot of people make a lot of false promises about what skincare can do. So you have to take that on a case-by-case basis and be honest with your patients and say, listen, here are the things we can fix with skincare. Here are the things we can't. And also, before you treat anyone with any type of laser light or, collagen stimulating modality, they need to be on real skincare. They need to be on at least an antioxidant and a retinol before you touch them with a laser for 4 to 6 weeks. It will save you a full laser treatment. It will save you. I mean, we know this also from data, right? This is not just me pulling it out of my behind and saying it to you on the podcast. It's me knowing when we're doing any type of like laser, especially any type of ablative laser, when you put someone on a retinol, a 0.05% or a 0.1%, it doesn't have, like, both of those have had the same efficacy in all the studies. It shows us that it minimizes, for 4 to 6 weeks before you treat, it minimizes their risk of complications with the procedure. It accelerates their healing time. It minimizes risks, associated with, post-inflammatory hyperpigmentation and other things. To take that a step further, if you're doing any type of ablative laser or any patients who have like any type of pigment history, they need to be on something to repress the melanocytes as well, the pigment producing cells. They need to be on a hydroquinone protocol. There are a lot of things that we know. Patients who have Asian and African ancestry, right? They need to be on a hydroquinone protocol before you hit them with a laser as well, because their melanocytes, no matter how fair their skin looks, their melanocytes behave differently. And these are things that are often overlooked in a lot of areas of medicine, but we have this data. These are all they're non-sponsored studies, they're not objective data that we have that shows that all of these things minimize risk and maximize outcome. And a lot of these things get ignored because is it a pain to put a patient on a hydroquinone protocol and be like, I'm going to call this in, or, you have to buy this, or however you finagle it with your practice. Sure. It's pretty easy. They start using it 2 days, twice a day for 2 weeks before your procedure. It's pretty simple. But most people don't do it because they're like, oh, they're here for a laser now, and they don't necessarily do a consult before they do the laser. They just kind of chat with them then. You will save yourself so much time and trouble, and you will save your patients time and trouble, and you will save them money by doing it. A lot of my patients, I'll put them on just a basic retinol and hydroquinone protocol for, 4 to 6 weeks for the retinol, a minimum of 2 weeks with the hydroquinone. And those patients that have done nothing for their skin ever, and they're going on to these protocols, and I don't necessarily have to use a tretinoin, right? I've actually found great success with even Skin Better, Alpharet, and things like that for patients who are like, I don't want to peel. That's okay. I don't want you to peel if you don't want to peel. That's fine. it's more expensive, right? But like, I would pay the money to not have to deal with the downtime, 100%. And then I have other patients where I'm like, nope, you're going to benefit more from the retinol, especially like those acne prone patients. Those are a little bit less negotiable. But those things, I've had them come back 6 weeks later to do, and you've seen this too, right? Like to do the procedure, and their skin is 50% improved.
Skincare in general as like the first step, you're going to get far better results if you just put that money into the skincare first. Don't put a patient on 7 to 10 steps of a skincare routine that's just one line because that's what one of the reps told you to do. Then tell the patient that they're going to get these amazing results in glass skin. That's not the solution. That's not going to get you to the glass skin that you're hoping for. It's truly what you said, sitting down, customizing that treatment, figuring out exactly what's their problem and what they see in the mirror, and then addressing it.
And how they respond to each product, absolutely, 100%. And it is like almost every single person is on a blend of different lines, right? Like I wish it could be as simple as going, oh, here's your line. And some people do better with other brands, you know what I mean? Like there are definitely people who it's like, oh, like they thrive with Zero, they thrive with Skin Better, they thrive with whatever. And other patients who are really sensitized to certain brands. And, we can't necessarily control, what our body likes, but there are factors that you can identify in those patients that show that they're predisposed to either do well or do poorly with certain lines based off of like, number one, experience, and number two, like the ingredients and things that they bring into the certain lines. Like there are a lot of lines that love to do a lot of like holistic stuff with it, which I absolutely love. However, this, I have beef with essential oils. Number one, I mean, they smell amazing. And I really do love essential oils. Like we diffuse them in our home, things like that. But there are certain people, and like my rosacea acne types cannot do well with a lot of essential oils. And ironically, some of them are like designed for them, right? It's like the sensitive skin thing. Like, oh, use this. It's for sensitive skin. They're like, wow, nothing's ever broken my skin out or made my skin more on fire than this one sensitive skin product or this whole sensitive skin line. And that's the essential oils are like that for me. And it's so hard because you have these things that are designed for people with redness, and then they're adding in like essential citrus oils and stuff. And I'm like, yeah, nothing is going to flare your skin faster. I won't blame you for trying it. I've tried them too, but there are a lot of oils that are added into different skincare products. And it also has to do with the extraction process and things like that. So I don't want to oversimplify it. But I do have a harsh relationship with essential oils because that's where we get into a lot of problems. I mean, even silly things like lavender, right? Lavender and things that people put into like different retinol blends. And it like takes so many patients out of being able to use that product. And they're like, wow, I started using this and my face like was just absolute hot fire. Or they push through and they're like, I did it for 3 months and it was still hot fire. It never adjusted, and there are certain products where I've had to pull them out of even considering it to be a use in my practice for my patients because there are just too many people that have, reactive issues with it. And not even like I've put them on it. It's just, it's self-reported. So there's some stuff that's honestly anecdotal, but it's really unfortunate because there are a lot of products and I'm like, if you just took out these 2 or 3 things, like this could be so helpful for so many people. And a lot of those come down to some of the essential oil additives and mostly like in mists and stuff like that, but also in some like retinol and nighttime based products and things. And other people do absolutely fine with it. So there's a lot of variability there, but there are a lot of things that, like more is not better when it comes to skincare in terms of number of things that you're using, but also number of ingredients in a product. It's kind of like the cold medicines on the market now. Like most of them kind of suck. They've got like some poor excuse for an expectorant. They're like a bunch of Tylenol and, a poor cough suppressant. You can make your own. Don't take this as medical advice. If you have a terrible, terrible cough, but you don't have that kind of mucus, why are you going to take an expectorant and a fever reducer / pain reliever if you just are coughing, right? So you can use just a cough suppressant for that. So you can tailor treat all of those things however you need to. And rather than getting like the treat all cough medicine that's kind of half-assing every single thing that you do, you can say, I've got a great, like Delsym is my favorite cough suppressant. I mean, I've got Tylenol or Advil if I need it. And I've got a nice decongestioner, a Sudafed that I can use. Always the over-the-counter one. And you can tailor treat every aspect of your cold as needed with those several things. And it's more effective to do it that way. And you can also titrate the amounts of different things. Like you can say, hey, I'm going to take 2 Sudafed, but I only need like 1, tablespoon of the cough suppressant. Skincare is the same way. We can tailor different ingredients, but only as much as the products themselves allow us to do. Like there are certain products where there's 60 different ingredients on the back of it. Does it make it a better product? No. And does it mean that something that has fewer ingredients is better? No. But you have to think about all those 60 ingredients have been, isolated. They've been extracted. The production process of those specific ingredients matters as well before they put them into that final product. So it's just a lot more moving pieces to deal with. That's where that, the issue comes in with less is not more, but more isn't more either. And it's so patient and product specific. And that's why we kind of will find a little bit more of those anchor products that we really love that work for 98% of people. And then I will personally help that other 2% figure out if that's not their product.
Mm-hmm. Well, what I love that you say first is you're not like, oh no, let's overhaul the whole routine and let's change it all up. You're basically saying, let's omit some things. Let's titrate off first. Most people, including myself, we think titration is supposed to be faster, or we want to titrate them off faster than we should. And so speak a little bit to that.
So I think even when it came to prescribing patients doxing, different things like that for rosacea flares, when I worked in the traditional aspect of dermatology, I would actually even titrate them off of those things. Because the thing is, if you're on a medication for 30 days, and I get it, that's the industry standard, that's best practice. If you're on a medication for 30 days and you're coming off and you're kind of using it to quell kind of an acute reaction, and staying with steroids for other things as well, even allergy medication for patients who are having specific reactions to things, cutting them off cold turkey at the end of getting acclimating to having that product present in your system. And I get it. I think the theory in regular medicine is essentially that those products have, function beyond the day that we take them off, right? They're active for an additional 10 days to 2 weeks in a lot of cases. And so the theory behind that is, you're taking them off, but they've got an extra buffer of time that their bodies kind of acclimate off. I just always explain to patients, I'm like, listen, we're used to having this thing. If we just pull you right off of it, your body gets a little bit upset, that it didn't kind of get to slowly kind of start to learn, how to not freak out without the presence of that thing. Again, whether it's a steroid, whether it's like a doxy style antibiotic, because those things also have other properties. So it's not just the antibiotic, it's also an anti-inflammatory. They're also doing other, actions within our body. And so aside from, supplementing them to support if we need to, if it's something like a doxy, I don't use that anymore. I don't need it. But back in the day, I was very much the person that was like, you know what, make sure that you're well supported, eat your yogurt, have some kefir here in our gut as well, so we're not creating other issues. I think that that's something that literally made night and day difference for a lot of patients and helped prevent flares from getting exacerbated in different ways from that. But also, it's the same premise with, whether we're titrating someone off or on something now, your body is acclimated to it for X amount of time. And it does become dependent to it, to a degree. And whatever it's doing, whether good or bad, cause and effect. So when we're taking someone off, say somebody, I have a lot of patients who overstrip, right? So they over acid, they're using an acid-based cleanser, they're using acid pads, acid products, stuff like that. I'm like, ooh, acid heavy. And their barrier is cooked. Well, I'm not just going to take them off all of that, because if I do that, their face is going to react to the acid. Acids pull moisture in, right? They're hydrophilic. So our body's gotten used to that acid, even though we haven't acclimated to the point of having, our great perfect skin that we're looking for. They've acclimated to having that acid around. And so if you just take them off of everything, their skin's going to freak out. And then they're going to think that what you put them on caused that. So you're saving yourself, in the end by doing it slowly as well, but also helping their skin learn, hey, let's not freak out. We're just going to slowly pull this product back. We're not going to say, oh, no acids ever again. We're just going to say, hey, we're going to give it to you once a day. We're slowly pulling the products off. And so my secret sauce for titration in most cases, 1 to 2 week model. And I actually present it always as 1 to 2 weeks, because what I like to do with my patients when I'm pulling them off of skincare, because you have those patients where it's yeah, their skin's, it's not bad, it's not great, but I don't know which product is causing us the most issue. So I will kind of titrate them according to what product I think is causing, the worst aspect of their skin, Say it's product X. Product X, I think, is causing, your little milia that you're getting around your eyes. So I'm going to titrate you slowly off product X. So this week, they've been using it twice a day. So the next week they're going to use it for 1 to 2 weeks, they're going to use it once a day. And I say 1 to 2 weeks because also I deal with predominantly women, and a lot of our, we have hormonal, ebbs and flows throughout the month. And so sometimes I always say, hey, pay attention if it's on your cycle and hey, I always get some breakouts around my cycle or my skin's angry around your cycle. You know that it's not the product changes that are causing that necessarily. It's just our normal hormonal fluctuation. And 1 to 2 weeks is if at 1 week I've pulled you, twice a day to once a day over that 1 week and your skin is absolutely thriving, proceed to the next step, which is to take it to every other day. But if you're at that 1 week and you see absolutely no changes and you're not sure if your skin's mad or if it's getting more upset or if it's getting, it's missing this product a little bit, pull it out for that 2 weeks. Pull it out for that 2 weeks. The other thing that this does is it also shows you how many patients are just using something at too high of a frequency. I can't tell you how many times I've done those kind of like tapered titrations with patients where they taper off of one product and they're kind of tapering down another one. And they're like, hey, you know what? When you said find, whatever frequency works for you with that titration, they're like, I realized when I used that, Alpharet clearing twice a week and used the regular Alpharet the rest of the week, my skin loved it. It just couldn't do that 10% salicylic every single day. And they'll come in and their skin is like killer. It's amazing. It was just like too high of a frequency of some component of what they were using. And we fixed it, right? So that saved me 6 different follow-up visits, a ton of different things because I've written out a plan for them for each individual thing that I want to take them off. So yes, it takes a while when you're in clinic. It also takes time, lots of handholding and a while to physically write out, ironically enough. But also, it takes the expertise to realize what, based off of their skin type and what you know about each product and, how they react to other things or what you think you need to taper them off first, second, third, fourth, depending on how many products they're coming off of. I mean, I've inherited a lot of patients that were on, 12, 13, 14 step skincare routines. And I fix their skin by taking them off 6 of those steps. And the other 6 steps are phenomenal and they love them. And so that's where, science and the art of aesthetics meet as well. Because, and I tell them wholeheartedly, I'm like, listen, like your skin is going to tell us, when it's happy. A decent cleanser that's not overly stripping, but still does a very good job of cleaning your skin, which you can use actually to double cleanse, right? In air quotes. You need an antioxidant to protect you from all of the free radicals that we face throughout the day, all of the blue lights and infrared and all of that stuff, but also to do some intrinsic repair, to help heal the cells that are already damaged and existing in our skin. And you need a retinol. You need a retinol to get that skin turnover going so their skin cells aren't so sticky, so that they're not as stagnant. You need some type of like exfoliation-based product to use 1+ times a week. Most people just once a week, especially in the Pacific Northwest. People up here, our skin is thin. They're very fair. That's like your typical like Pacific Northwest patient. And so for them to like think that they can use like a heavy-based exfoliating polish as directed on the packaging every day, twice a day. I'm like, no. I'm like, ignore the package. And that's a hard thing, right? It's like you're telling people, don't follow the instructions on the package. Listen to me. Kind of finish like the things that we need, just plus or minus an anti-aging. Most of us could use it, but that's something that is cost prohibitive sometimes because a lot of the better anti-aging products are expensive simply just because of what they contain. Pigment treatment, plus or minus, do you have melasma? Have you had melasma? Do you have sun damage? Is there pigment that we want to correct? Do you have redness, and plus or minus eye. The best piece of advice I ever got from a plastic surgeon that I used to work with was 90+% of things can literally just be taken up underneath your under eye. Don't put them in your eye, but you can literally use so many of your skincare products, so many of your actives up into the under eye area that if the last product that I'm going to add in on someone likely is an eye specific product, because a lot of the active and other products that you're using, careful with the prescriptions, always ask us. That's like the little star, and other retinols and other based products, always ask your provider. But a lot of them can be and are designed to be, even though that skin is slightly thinner, we can use them underneath our eye, still get phenomenal benefits from that. And we don't necessarily have to add in an extra product. I would rather have them add in an anti-aging product than an eye-specific product. Invest in your actives. Do not invest in your moisturizer unless your moisturizer contains other things, like the Eyes Clinical Youth Intensive Creme. Oh my God, chef's kiss. That is an insanely good moisturizer that weirdly has a very mild exfoliant in it. It has a very, very gentle constitution, almost like a serum-based like consistency for moisturizer. It has growth factors. It has antioxidants. That is a phenomenal investment moisturizer that I honestly call an active moisturizer, right? But most moisturizers are glorified, overpriced, like nothing. And you can buy cheap nothing, and seal in all of your actives like that if you need to. That's where, you have some patients that are married to their CeraVe or Cetaphil. I'm like, listen, if you're doing all of your other actives, you can have your CeraVe at the end. But I need you to put everything else on first and and then you can add that last. But typically, even at that point, you fix their skin so much, you enhance their skin so much at that point that if you want to transition them to something else, or if they're like, you know what, there's a little bit more that we can do, I'm like, yes, that's the last step. But if that's something that they need to keep, that's fine. All the other things underneath that are more important.
As long as it's not offending, it's not an offending agent, you're like, you can have it.
And I'm not a slugger. I don't support that, because don't forget too, you're sealing all of that, the dead skin and those products in. So you're not getting that like as much exfoliation, you're not getting as much skin cell turnover. So for older patients, absolutely, it's kind of essential. But for a lot of the younger patients and people in their 30s that are coming in that are like, I have this acne, I don't know why. And I'm like, why are you putting Aquaphor on your face at night?
Do you want to speak to TikTok trends?
Trends that are non-fashion based when it comes to skincare or wellness or other things can ruin a perfectly good item. Aquaphor is great. We love Aquaphor. It's great to kind of seal in some moisture around the lips. It's great to use barriers when we're doing, different peels and things in the office. It can be really helpful for healing wounds. Aquaphor is phenomenal. However, if you have acne, please do not put Aquaphor all over your face. That is something that TikTok told people, and I don't know where that trend came from. I think there are people who will tell patients to use, like gentle-based moisturizers to reduce the potency of a topical prescription retinol and other things like that. Again, instead of titrating them, they're having them kind of cut the product with something else. Understandable. I'm not sure where the line got crossed between putting a mild, like non-comedogenic lotion on your face before your retinol and just throwing Aquaphor all over your face at night. And there are some people who can do it like the Pond's cream thing, right? Like my mom's generation would put the Pond's cream on before they would go to bed, which ironically is also less irritating than Aquaphor on your face. And there are some patients who have, other skin conditions that can thrive with it. And I think that people are maybe so passionate about something that they've found that works for them that they think it works for every other person the same way, or they've been sponsored. I cannot highlight that enough. Many of these people are very much sponsored by some of the products that they recommend and the lines that they recommend. And that's why they have a 25 Drunk Elephant skincare base, program, because Drunk Elephant Skincare has sponsored this membership.
Or they are sponsored and they do not use the skincare.
Yeah, because I would see those patients in my office and I'm like, I know they're not using that, but they're doing these posts on these different things that they, especially in LA, right? Where they're like, oh no, but I'm sponsored for that. And I'm like, oh, okay. I always say just be cautious when you're on the internet seeing those things, because someone who's genuinely excited to share something with you that worked for their skin, that's absolutely fine. But we have to work in the realm of statistics, right? Is this going to work for 90% of people? If it's going to work for 90% of people, sing it from the mountaintops. Absolutely, 100%. And just say, hey, it might not work for everybody, but this is going to work for 90% of people. That's amazing. Gentle cleanser, right? Like Zeo Gentle Cleanser or Simply Clean from SkinCeuticals. Like those are killer products that work for 90% of people. And I can say that with solid confidence. Amazing, right?
This is not sponsored.
And I would be the person that's sponsored, be like, I hate this. And I can tell you the products that I hate from their line too. I work in the realm of statistics, and that's the problem that those trends do not work in. They don't live in a world. Does this work for most people? Is it effective for a lot of people? Can it work for some? And you have those people that will viciously defend it with their last dying breath. Absolutely. But most of those trends, like most things on, social media, are inflammatory, right? And some of them are, I think, probably started as a flat out joke. Like, do you not think that the beef tallow thing started out as an actual joke of someone just like Miss Lippy in Billy Madison? Miss Lippy smearing paste on her face, like while the kids are at recess. Like, that's what I think of when I think of the beef tallow.
The beef tallow is irritating.
It's one of those things where I'm like, if it works for you, amazing. I will never, like, there's nothing about it that would, I guess as long as you're sourcing it well, because some people are obtaining it themselves. And I was like, that's actually dangerous because you can literally have bacteria that's growing in there. And I'm not sure where you're getting that yourself, or they're making it or doing all these other things. I'm like, but that is something where I'm like, I don't want you smearing bacteria on your face that can quite literally cause other problems, right? But in terms of like I've seen people use clarified butter on their face, right? That won't harm you. Is it going to do anything great for your skin? No, but you have people that swear up and down that's what changed their life. And I will never, take that away from someone they're like, this changed my existence. My skin is now better. Also, if you have photographic evidence, bonus points, right? And I will also never say never, right? Could there be a beef tallow based product in the future that changes our lives? Maybe. Do I think that's feasible? No. Most trends are inflammatory. Most trends are outliers. Most trends don't work for the majority of people, but they are novel, and that's what attracts us to them. And that's what gives them like this ability to blow up in social media circles and things like on TikTok, because it's something novel and it's very interesting. And so, the aspect of that dies out. And now I have patients that like, they see how bad slugging is, or their friends are slugging, which is the Aquaphor trend. And they now don't want to use Aquaphor for anything. And I'm like, no, we still love Aquaphor for those things. Like, we can still use Aquaphor. That's the thing. When the pendulum swings one way, it's going to swing back the other way a lot more aggressively. And the same way that people fight against filler, because there's bad filler that exists in the world. And you have those providers that are, fueling that by saying, oh, filler is so awful. And look at this scan of someone's face that still has filler in it, and all these crazy things in the world that, again, they're looking for likes. They're looking for views. This is to trick you into thinking that they found something really cool and novel, and they're making people emotionally, not necessarily invested, but like emotionally heightened. They're targeting their emotional response
to get views.
Yes, and shares.
Which is the irony of that, because specifically I know that some providers that are going onto social media and spouting that dermal filler is bad, and you personally know some of the work that has come out of their clinic. And it's like, but I thought you don't believe in filler. But that patient looks like a Catwoman. Who just got fresh filler.
Yeah. You hate your filler? Do you hate the filler that you do? Like, is that where this is coming from? And don't get me wrong, like, literally any aesthetic treatment can be awful, right? Like, it can be in the wrong hands, with the wrong application, the wrong methodology, it can be absolutely disastrous, right? But so can most things. You can die from drinking too much water. Are we going to tell you, oh, don't drink water anymore because somebody died from drinking 10 gallons at once? No, just don't drink 10 gallons of water.
I think it's easy for us to get into like an always versus never, or like taking a good thing and like overdoing it, right?
Yep. They want dichotomy and they want instant. They want it to be a yes or no. We either like filler or we don't. Us like giving them the explanation of like sometimes is like, shit, that's not super, it's not exciting. I get it. It's kind of dull. It's like the skincare stuff. They're like, oh my God, you want me to do this over 3 months? And I'm like, I'm sorry. I wish it could be faster. I really do. Like, I would remote click it faster for you if I could, but it's just not the way that it works in most people's best interest. And it's the same thing with all the inflammatory statements. And again, most of them are literally just to get engagement. And I mean, they make money off of the social media platforms and stuff like that. So it's hard. There are also a lot of really honest people on social media platforms, and I love that. And some of them do become just as popular. So I always say, don't discount someone, just because they're on social media. I think social media is a great tool, and it does help introduce a lot of people to a lot of different concepts and things that they might not have seen before. Like we were talking about the facial, like the filler balancing and all of that, like facial balancing and harmonization and stuff. But we have to understand, like, are those providers actually doing it? Are they doing it the way that it should be executed? Are they like, practicing what they preach? Like, if you're doing a ton of dermal filler, but also hating on dermal filler on your social media, that's a little sketch.
Baseline values, people. And integrity.
Totally. And be honest too, because you can also change your opinion. Like, there's stuff like, I used to do Ult therapy when I worked at Ideal Image, and I don't really like Ult therapy now. I've never seen any results from Ult therapy that I couldn't produce with something else that is cheaper, less painful, and a better result that I could make from another device. That I said, hey, you know what? Like, I've learned that I can do more with less. and more comfortably. And so that's not my favorite device anymore. Or other products where you're like, you know what, like, I don't think you're going to see much of a difference with that, right? So there are things that I'll say like, can it be decent? Can it be well done? Sure, but in the right hands and in the right conditions with the right patient.
But I think that that's the good part about it is that you're open. Like, even when we talk about beef tallow, never close that door.
Never say never. It's medicine.
Yes. So I think the fact that you care enough to stay up to date, you're watching things, you're seeing things, like, but you're never closing yourself off. And you're also willing, I think that's where like the ego comes in and being able to check your ego and say like, oh wait, like I actually changed my opinion on that. I think the people that are really giving good results and are really caring about the patients are the ones that, I don't want to say that are going to stick around in aesthetics, but are going to be the ones that are,
they're in it for the long haul because their results are in it for the long haul.
Yeah, like making a difference that's like a good difference. The one thing that we didn't really touch on was the fact that when you do transform someone's skin or you do give someone a really great result, like at the end of the day, that's a great feeling for the patient and it honestly makes you feel good too. So it's like doing the right thing, I feel like is always a win.
Always. And honesty, because it will save you and your patients the time and the trouble of false promises. Like lying to your patients or saying like, this is going to be the best thing that you've ever used in your entire life. You know what I mean? Like that, like the rep-based promises. Like we love our reps, but there are some things where they're like, this is the best product that I've ever used it, like singularly in my entire life ever. I would die for this product. I'm like, listen, it's a face wash. It could be a really good face wash, but like, I don't need you to suffer to prove it to me. I'll try it and also my patients try it and then we'll find out it's going to be okay. And people don't want to invest in things necessarily that aren't getting pushed like that. But I will never push something like that. Like if I think something is great, like I'm obsessed with Plated. I use Plated. I've loved it for years. I've used it for quite a long time, and I have had a lot of success with it personally. And not that just because I don't have success with something personally with my skin doesn't mean that I'm not going to recommend it to other people either. I don't want to oversimplify like that. But there are things that you inherently believe in because you've had them, you've tested them. Like a lot of products, I actually test on a patient who are willing. I'm like, here, I'm going to give you a 6-week supply of this, and I want you to tell me your open and honest opinion about it because I want to try it on different skin types on different people. That's how, if I'm not familiar with something, I gauge, what a product can do. And you need, right? You can't have a biased research study. I'm just kidding. It is our anecdotal research, but yes, it's our bootleg research. But those are things where I'm like, okay, I've got a couple of patients who are on it who have this type of acne. I have patients who are on it that have rosacea. I have patients that are prone to these different things. And those are how you kind of, can sift through products, especially when you're a newer provider with different brands that you're not as familiar with. You need literally trial and error because every rep and every company is going to tell you that their products is the best thing. And after you look through the ingredients, you go, why is this peptide-based product $300, and you have salicylic acid as like the first ingredient and water. And then you've got like, a handful of peptides here or there. People aren't going to love that, unless there's some science behind it and you have your own testimonies. And I had patients on things for 3 months, 3 or 6 months where I'm like, I genuinely need to know. Or patients that are interested in buying it, I'm like, absolutely get it. But if you could just tell me, your honest opinion after you've had this for 3 months or whatever. And before I recommend things to patients, I'll have at least, 20 like recommendations from other people. And I'm honest and they'll ask me about something and they're like, hey, like, how do you feel about it? I'm like, I don't know yet. The jury is still out. Like I have patients that are trying it. I'm trying it, but I'm waiting for feedback.
What are your thoughts on masking? And then how do people incorporate that, or how do they add that as obviously an addition after they've gotten their skin looking amazing and they have their routine down? Like how do you typically incorporate quote unquote masking?
There are a couple different things that you can actually incorporate kind of while you're on that skincare journey. Because I actually love the Eyes Clinical Warming Honey mask, or it's a cleanser, but I actually have them use it as a mask.
I love that. Yeah.
And so that's like one of those products where I'm like, I actually don't mind incorporating them, even if they're, we're dealing with acne and we're dealing with rosacea, other things. I'm like, okay, do your initial cleanse, pat dry, apply that on your skin, kind of massage it in. The honey is a little antibacterial. It's a little anti-inflammatory. It feels really nice. It also isn't like regular honey where it like drips off your face as you're kind of like trying to do things around the house while you're masking. So there are a couple different, products and lines that I actually don't mind patients using on their journey. But in terms of once you've kind of dialed your skin in and you might just need like a little bit of a zhuzh, you always want to balance masking. So a lot of times you'll have patients where it's like, oh, they're maybe like a little oilier or a little more acne prone. So they're inherently always going to go for, a drying mask, like a clay mask. That's kind of what's always like touted for patients that are oily. They're like, oh, clay mask. Okay, great. But once you've stripped your skin with that clay mask, because most of them are a little bit drying, balance it out, right? Whether that's with a collagen-based, mask on top of it. Like I like to stack mask or mask stack, however you want to say it, where, okay, we've dried you out, we've kind of sucked that oil out, but now you can use kind of like an oil-free, product on top of it. Or it could be something as simple like your copper mist, right? You could use your copper mist on top. But when you strip, you have to rebuild. So you can't overdo with some of those maskings. I will tell you, like, that baby facial mask, right, from Sephora, that's actually a decent product. I like it. I don't really use it now. There are better things. But I accidentally didn't read the instructions for that years ago. And I did like one of those at home kind of like microdermabrasions, put that mask on and left it on for a solid at least 30 minutes before I realized, wow, my face is really burning. This is probably not good. Come to find out, like after reading the package instructions, so always read the package instructions. It's a 10-minute mask. I burned the top layer of my skin off. Now, it was a beautiful peel later on. Like it actually looked amazing. Silver lining 4 weeks later. But there are things where, you always want to be sure like what you're addressing is and how you're doing it. Like I've had a lot of patients home dermaplane and then throw a mask on their face and they're home dermaplaning with, an essential oil type based product. They're dermaplaning their skin and they're sometimes going, the wrong direction, opening a bunch of their pores, irritating, rinsing that off and then applying a really abrasive clay mask. And then they come in and their barrier is cooked off. And I'm like, listen, no judgment. Been there, done it to myself. Here's the deal. That takes us, for patients that aren't already acclimated and don't have that perfect skincare routine, and we haven't really done skincare with them yet, that can take 6 weeks to 3 months to resolve because you have to rebuild that whole fried off barrier. And if their skin wasn't super happy before that, if your skin was super happy before that, like we can kind of fix it in 2 to 4 weeks, depending on how bad it is. But if your skin wasn't happy before that, it's going to take 6 weeks to 3 months to repair that skin barrier. And that's not me. That's just, it takes your skin that long to repair. And people who tell you, oh my God, nobody can do it faster. I'm like, listen, that's one skincare cycle, right? 6 weeks minimum to rebuild something. Typically it's 3 months, depending on how bad the damage is that you've done. So those are things where, you have to make sure that you're really balancing it. And some of my favorite brands for masking are dirt cheap. Like Karuna makes bomb collagen masks. They're like $9. They sell them on Amazon. And normally I'm like, medical grade skincare. Masks are not necessarily like that. Like kind of like the jelly masks and things like that. They're not ingredients that contain a ton of actives in them. A lot of what you're getting is a little bit of occlusion, hydrocolloid, pimple patches and things like that for people who are more prone to acne can be really, really helpful. Those are also dirt cheap. Like there are a lot of great masking options, but if you are stripping your skin ever with a mask, if you're using a drying mask, please rehydrate after and not necessarily with a moisturizer, especially if you're acne prone. You can use an accompanying mask, like a collagen-based mask, and those can be incredibly helpful. Even like the Dr. Jart ones, those are from Sephora, right? Those are really, really great. Ology is another really good brand. A lot of these masks are not reinventing the wheel. You do not need to invest your money in like the $200 patch masks. There's nothing in there that's really doing anything that exceptional for your skin unless you're doing it like post laser or something and you need really clean products that are safe to be used on open skin, which most of those are not. So if it's something that, is getting recommended by certain providers, or like the SkinCeuticals has kind of a more expensive one, ZO has one. There are certain things that you can use post-procedure that would be worth more of an investment. But like just day to day, like if you're like, oh, my skin's looking a little dry, do your exfoliation, do your shower, do your ZO polish, whatever you're using, exfoliate very nicely, and then put like a nice calming mask on your skin. And they do not need to break the bank. Unfortunately, all of my skincare recommendations in terms of product, they're very expensive. But my mask recommendations, I could, like almost everything is under $10 or under $20 for some of the bougier Sephora ones, right? And normally I will never tell you to buy skincare at Sephora. Masks are the exception. And there are a ton of different protocols too that we could even go over with a lot of that stuff. But just if you're drying yourself out, if you're purging, if you're doing things that make your skin sensitive, less is more. Like if you're dermaplaning and you know that you're sensitive to that rosacea skin type or you're acne prone, rinse your skin with clear water, copper mist, leave it alone. Don't you put another thing on top of that. Less is more with those. If you're dehydrating, please engage in some rehydrating afterward, but nothing super occlusive and nothing based for those types of patients.
You can tell that you are very, very passionate about skincare. I go to, at least for myself, when it comes to questions and all things regarding skin. So we'll cut the episode here.